Lupus is an unpredictable and inconsistent autoimmune disease. It can be difficult to diagnose and challenging to treat. For patients, reaching a diagnosis is often only half the battle. It's the day-to-day unknowns of living with this chronic illness that can leave many feeling powerless. Today, managing your lupus with confidence and one woman's compelling story from adversity to empowerment. I'm Erica Vetrini. Access Health starts now.
Whenever I tell people I have lupus, everybody usually says, "But you look great, you look amazing." And I don't always feel amazing. I think that that's the hard thing about lupus. Back in about 2003, I started noticing that I had really bad headaches at night. They primarily struck me in the middle of the night. Strangely enough, they'd wake me up out of my sleep. I had really stiff joints in the morning, and it was just a struggle to physically get myself out of bed in the morning. I finally decided it was time to go to the doctor when I was combing my hair and realized that I was missing a patch. Actually, a couple patches, like right in the middle. And that's what made me go to the doctor. Not the pain, not the achiness, not the fact that my fingers turned weird colors in the cold. It was my hair. I'd had these symptoms for about a year, talked to one other person, and they told me it was something else. My headaches were due to a sinus infection. My joint pain was because I was in a dance team, so I was probably just achy because of that. So that's what led it, being told that what you're feeling is probably just, as opposed to actually trying to see what those symptoms were, is what delayed me going to my primary care in the first place. So my primary care physician was familiar with working with a rheumatologist, so he sent me to her, and she literally looked at all of the different symptoms that I had, as well as my blood work, and really we had a real in-depth conversation about what I'd been feeling, and she was pretty clear. She says, "I have no doubt that you have lupus."
In lupus, something goes wrong with your immune system, the part of the body that fights off viruses, bacteria, and germs. Your immune system cannot tell the difference between these foreign invaders and your body's healthy tissue, so it makes autoantibodies that attack and destroy healthy tissue. For those with lupus, this can translate into a chronic struggle with troubling symptoms that can interfere with their quality of life.
Being diagnosed with lupus at that time, I was very relieved because it made everything make sense. It didn't seem like all these things were just random, isolated problems that I needed to deal with. It was so good to have it packaged in something and know that I'm not crazy. At that time, I was in college, and I was extremely active on campus. I was a part of all of these different clubs and organizations. I was a leader, and it meant a lot to me to be able to do all of that. I would say probably about the first year and a half, it was really hard. I had to really zero in on what were the things that I most needed to do to feel like myself. When I was trying to figure out what my life would look like while having this illness, that was really challenging. And modifying my life to accommodate having lupus, having to move my classes a little later when I know I'm a morning person, that was a struggle for me. My friends, they didn't understand right away. I feel like they took it as I just didn't want to hang with them. And, we had a history of staying out till the sun came up. It just got harder and harder to the point where I just sometimes had to say no. Sometimes they'd call me, I'd say I'm going to get ready, and I would lay down and wake up and it'd be the next day. And they took it personally. I had to start being honest with them and myself that, I can't do everything. My life is not gonna be the same.
Good morning and welcome to this special edition of Access Health. As we just heard from Chanel, the effects of lupus can be extremely disabling, stressful, and often unpredictable. Well, joining me today to shine some light on this mysterious disease is rheumatologist Dr. Joan Von Felt. Doctor, thank you so much for joining us.
Erica, it's a pleasure to be here.
Now, doctor, you've been studying lupus for over 30 years. Tell us, why is it so misunderstood and so difficult to diagnose?
Well, lupus is an autoimmune disease. And autoimmune diseases are diseases where the body actually acts against itself. And in lupus, the body acts against itself in many different organs. So it can affect the joints, it can affect the skin, it can affect the kidneys, and sometimes it can affect those organs in different times and places. So a patient may notice that she has more fatigue and joint pain, and she goes to see the doctor. By the time she gets there, maybe that has gotten better. And sometimes it takes a while to have the final diagnosis.
So are there certain people that are more at risk than others?
No one really knows what the cause of lupus is, and it's been studied for a very long time. We know that there is some genetic predisposition. It's much more common in women. The ratio is 9 to 1.
9 to 1?
9 to 1. And then there are probably some environmental factors that we just don't know that predispose. We do know, for example, that certain ethnicities have a higher risk of developing lupus.
Well, we do know that the symptoms are affecting their lives.
Well, the most common symptoms that patients see their doctor for are fatigue, joint pain, and rashes. So those are the most common manifestations of lupus. Having said that, they can have only kidney disease, for example, or only lung disease. But those symptoms can be very disabling and can be mysterious unless the right tests are done.
But doctor, because there are so many variables and so much unknown, how do you develop a treatment plan?
A rheumatologist is going to evaluate the patient and evaluate not just her symptoms, but also her laboratory studies to make sure that there is no hidden evidence of inflammation. The treatment plan will be designed to try to modulate that. There's no cure for lupus. There's no infection that we can get rid of, but there are plenty of medicines that we can use to modulate that immune system so that the patient feels better.
So as a patient, how can they be more involved with their own health?
The most important thing that a lupus patient can do is advocate for herself. So she should learn about the disease, she should learn about known triggers for the disease, and she should keep a diary because it may be that she has triggers for her disease. And the most important thing is to be honest with her doctor. Make a list of what you plan to talk about, what things are bothering you. So I think it really has to be a mutual dialogue.
Doctor, thank you so much for joining us today. So much good information, and more on lupus when we return. Welcome back to this special edition of Access Health. We've been discussing lupus, a chronic autoimmune disease. Not only does lupus affect the physical well-being, it can also affect a person mentally and emotionally. So joining us now is Dr. Betsy Bennett, an expert in clinical health psychology. Doctor, thank you so much for joining us today.
Oh, thanks for having me.
So we've talked about how unpredictable lupus can be and how it's so taxing on the body. But can you talk to the emotional challenges that come with lupus?
Lupus comes with a lot of emotional challenges. Probably the first two that people would think of would be anxiety and depression. And of course, those are things that any person should talk to their doctor about. But even if you're not experiencing those things, or if you are, there are other aspects that make lupus just really difficult, and I think of those as sort of three big challenges. So there's this sense of unpredictability that you just never know when you're going to be feeling good. You never know when you're going to be feeling bad.
Because there are those flares,
Yes,
right?
those flares, and they can come on so quickly and without warning. And it really can leave a lot of people feeling just like they don't have the sense of control that the rest of us really get to take for granted.
They can't plan.
Yeah, you can't plan. You just feel like, I don't know what's going to happen next. So that's really taxing, as you can imagine. And then on top of that, like if that wasn't enough, there's also the sense that people can't tell that you're sick. We call that invisibility. And then the third thing that makes it challenging is the cognitive issues that can come along with lupus. So many patients with lupus, not all, but many will have memory issues and some kind of cognitive slowing, so they just feel a little fuzzy or foggy, sometimes people will say. And so just at the moment where you need to feel quick, to be able to come up with a response and come up with something to say, you actually might feel like, oh, I just forgot that, or what did I want to say? And it makes it just all that much more difficult.
So then having to bear all of that, how do you help them deal with that so that it is more manageable?
One of the biggest things that make each of those things difficult is really gathering up the confidence. Like, I gotta say something, I have to explain this to someone who doesn't get it. Not only someone who doesn't get it, but someone who's probably or could be irritated at me because I can't do what I thought I was gonna be able to do. How do I manage this? And I really think that the best way to do that is to have a phrase at the ready that you can use in each of those situations. So one for the unpredictability, one to explain the invisibility, that you can't see that I'm sick, and one to explain the like, hey, I might need you to say this a couple times because I'm feeling a little foggy today. So if you can have a phrase, we call them hip pocket phrases, for each of those situations, the more you use pretty much the same phrase over and over again, then you don't have to think about it. It's done.
I'm sure, and sometimes your emotions come into play too. So if you have this hip pocket phrase that you can use no matter how you're feeling.
Yep.
So give us some examples of those hip pocket phrases.
Yeah, so in dealing with, for instance, invisibility, you could say, I'm really sorry that I can't come to the presentation at work today. I know you were counting on me, but I have lupus, and I know you're looking at me and you're saying that I don't look sick, but lupus is a disease that really rarely makes a person look sick. It affects the internal organs. And so I feel very sick and I am very sick, but you can't see it. So a similar kind of idea for unpredictability. I'm sorry I can't drive carpool today. I know you were counting on me. I have lupus, and lupus is a disease that by definition is unpredictable. My rheumatologist has explained to me that you can't know when severe symptoms are going to come on.
Well, what if those that are close to you, your loved ones, don't understand?
Probably the best thing to do in those situations is to step back and think about what you want versus what you need. So you're educating someone about lupus in that moment, right?
Yes.
You're also perhaps disappointing them. You're telling them, I can't do X, Y, Z, I can't come to the party, whatever it is. So what you want is more than likely something emotional, something kind. So you want the person to say, oh my gosh, please go take care of yourself. Or gosh, I didn't know that about lupus. Thank you for telling me. Thank you for confiding in me about that. But what do I need? What I need is for that person to be informed that I can't come to the party. And that's it.
I love that you're giving us real, practical, useful tools to take away today. Thank you so much. And you're not going anywhere. But right now, we're going to check in with Chanel for more on her story.
After graduating college, I moved into the arts. I'm a performing artist, a poet, and a singer. I had to figure out how I can make all these moving parts trying to be successful and build a career, as well as manage this illness. But, while you're being so ambitious, it's easy to not remember that you have to take care of yourself too. I programmed things into my schedule. I programmed the things that made me feel good, the naps, the breaks, and tried to treat them like they were meetings, like this had to happen, or I wouldn't be able to do the other awesome thing that I have planned. So my rheumatologist, she was great at like just trying to have a conversation about what would work. And I think the process of getting, when I say relief, I don't mean it's gone, but just learning how to manage my symptoms, as well as just having an idea of what are options for me. And while some of the options didn't work, or some just felt a little bit worse than others, we really went through a lot of different things and a lot of conversations to help figure out what worked best and what made me feel like I could actually get through my days and be able to do all the things that I cared about doing. Now I am very focused on just health and wellness, taking care of my body. I am very active as far as like wellness and fitness. So I do yoga, I occasionally do some running, but I'm very active in just making sure that my body is still moving. I know that for me, my joints feel worse when I don't do movement, when I'm not moving. I know that for me, when I eat certain things, that it aggravates my system. So I'm kind of trying to avoid those, although I will have the occasional chocolate chip cookie. I do know that there has to be a balance for me to be able to be okay. I have a great job where where they understand that I have this chronic illness, and that it's sometimes, while I am absolutely 100%, when I'm 100% there and on point, there are gonna be moments where I have to step back, but they get a better Chanel out of the deal. And I just feel more understanding of what my lupus looks like. I do recognize it's still unpredictable, but I feel like I'm in a space where, you know, I'm in control of what's going on for me as much as I can be. And I've gone places and seen people and they're like, you wrote this article, and I remember, and it helped me, and it feels good. It encourages me to like keep going, because the idea that I could be inspiration to somebody else means a lot. That I could be an inspiration to someone else. It helps me continue. It helps me want to stay well and do well. I really want to like walk into that like purpose that I have, that I can do the things that I am able to do. I want to do them, and I want to cherish those moments that I have, the good times.
Welcome back. We are continuing our conversation with the wonderful Dr. Betsy Bennett. Doctor, we've covered so much today, so much good information, and you talked a lot about how practice is important.
Yes.
Do you have any resources or tools, concrete tools for patients out there?
Yes, absolutely. And I'm so glad you asked that, because I hate the thought of someone watching our show and thinking it went too fast. I can't do that. Yes, you can. So we developed, in conjunction with GSK, a series of workbooks, really. I like to call them workbooks, because it's not something that you just passively read and you hope that you got it. We have real exercises in there that you can work through. So for instance, here's one. The series is called Speaking of Lupus, by the way. And here's one where we would take you through the exercises for creating your own hip pocket phrase. Incredible. So we give samples of how we did it, how you might do it, step by step. And you can practice as much as you like until you make them your own. And then we give you an exercise on sorting out your wants and your needs when you're talking to someone and they don't react the way that you would like them to. Can really, really help you clarify your thoughts in a situation that can be emotionally difficult.
And so what about doctor-patient relationships?
Yeah, so I'm glad you asked that. So one of the books that is part of the Speaking of Lupus series specifically talks about how to improve your relationship with your doctor. Many lupus patients are fortunate to have doctors they really, really click with, but other times patients are like, you know, this relationship could use some building. You know, I'd like to know more about this. And this is filled with exercises that you can do to help you think about that that relationship in a new way. And of course, we have things like a lupus journal so that you can keep track of those symptoms. And of course, without going too far afield on this, it is so important to be honest with your doctor.
Doctor, thank you so much for being here and for all that you do for the lupus community, but also for helping us all empathize with those that are living with lupus. We want to thank everyone who helped us tell this story today. If you missed any part of this discussion, you can go to our website, as always, accesshealth.tv, and you can also visit usinlupus.com/TV. We'll see you next time.